Good afternoon, sir. My name is Ronald Sinapang, and today I'll be preparing and changing the IV solution and tubing. Next is the purposes of this is to maintain the flow of required fluids. Next is to maintain the patency of the IV tubing. Assessment. First, I'm going to assess the presence of fluid infiltration, the leakage, the bleeding, or phlebitis on the site of the IV site. Next is I'm going to assess the allergy on the tape or the iodine. And also other assessment includes infusion rate, the amount absorbed the blockages in IV system, appearance of the dressing, integrity, moisture, and need for change. After that, I'm going to wash my hands. Hand washing deters the spread of the microorganisms. Hi ma'am, good morning. My name is Roanne. For today, I'll be preparing changing IV solution and tubing. For the solution change, the materials is IV solution by the order of the physician. For the tubing change, the materials is gauze pad and administration set. After that, I'm going to gather all the materials needed during the procedure into the bedside. Having equipment available to save time and effort and also facilitate accomplishment of tasks. Next is I'm going to remove the outer plastic packaging, and after that I'm going to squeeze the bag and test the expiration date. After that, hang the new IV solution into the pole. This ensures the sterility of the IV solution and ensure the correct IV solution is to be used of the patient. After that, I'm going to close the clamp on the tubing to stop the infusion and prevent air bubbles forming into the IV solution. So next is I'm going to remove the protective plastic cover from the new IV solution tubing port. Okay, after I remove, I always keep IV tubing sterile at the all times to protect from any contamination area. Next is I'm going to remove the IV solution bag from the IV pole. Turn IV bag upside down by grasping it. So I'm going to start now. Removing IV solution from the pole, this prevents spilling from the IV solution. After that, using a gentle twisting motion, I'm going to firmly insert the IV spark into the new IV bag. This allows for the uninterrupted flow for the new IV solution. So I'm going to insert now. Next is fill the drip chamber by compressing it between your thumb and finger. Ensure that the drip chamber 1 1/3, 1/2 full by checking it in the IV tubing. fluid in the drip chamber helps to prevent air bubbles from introduced IV tubing. Is I'm going to open the roller clamp and regulate flow rate via gravity as a physician's order. This delivered correct drop rate of IVF as a physician's order. After that, I'm going to make an IV label and attach it to the IV tubing, the state of the date, the time, and the initials. This ensure accurate continuation and administration of the correct IV solution. After that, dispose materials properly. After that, I'm going to wash my hands to prevent the spread of microorganisms. Next is for IV solution and tubing. For IV solution and IV tubing changing. Next is I'm going to open the administration set, removes protective covering from the infusion spike. So now I'm going to open the administration set. Using the straw technique, insert the new container and prime new administration set. Insert the IV solution bag and new IV tubing. Priming removes air bubbles of tubing. Next is hang the new administration set into the IV pole. This refers the equipment adheres to the principle of the aseptic technique. So now I'm going to hang into the IV pole. Next is close the rural clamp of IV administration set to stop the flow of infusion. Clean the connection between the distal end of IV old tubing of the positive pressure with 15 seconds and let it dry in 30 seconds. After that, place a sterile gauze pad under the needle hub. gauze observe any leakage when tubing disconnected from the needle. Next is I'm going to remove the protective cap on the distal end of the new IV administration set to keep administration set ready. So now I'm going to remove the cap. Next is I'm going to open the roller clamp in the new tubing to regulate the flow rate. Of course, opening allows the solutions to the client. Next is I'm going to check the IV site for patency, sign and symptoms of phlebitis. Of course, IV site should be free from redness, swelling, and pain. So now I'm going to check the IV site. Ano po yung pakiramdam nyo na yun, ma'am? So next is I'm going to reapply or change the sterile dressing according to agency policy, because this deters the microorganism or the site. Regulate the IV flow rate according to physician's order. This ensures that the correct client receives the IV solutions to the prescribed rate. Next is I'm going to make IV label that attach time, date, and the initial. This is according to the agency policy. This document make IV tubing change. Next is I'm going to discard the old equipment that I've been using during the procedure. After that, I'm going to wash my hands. This deters the spread of the microorganisms. Next is I'm going to record the client response to IV infusion. This ensures accurate documentation of the client responses during the procedure. Next is discontinuing and removing intravenous lane. This is the materials that I'm going to use during the discontinuing and removing of intravenous lane: plaster, cotton ball, alcohol, gauze pad, forceps, kidney basin, disposable gloves. Good morning, sir. My name is Ron Alcinapang. May I ask po, sir, what is your name po? Okay. Birthday po, sir. Ngayon po, sir, I'll be discontinuing na po natin as the order of the doctor. If may tanong po kayo, sir, please to ask me po. Okay po, sir, thank you. Okay, sir, this indicate the patient, he or she required IV fluid for us to know or notify the physician to know if we need to continue the IV. After that, I'm going to sanitize my hands to prevent the spread of the microorganisms. I'm going to open the sterile gauze and place into the easy access and close by. After that, I'm going to wear my clean gloves. After that, I'm going to moisten the adhesive tape. I'm going to put the gauze pad. After that, I'm going to put the new gauze pad, hold into the 2 or 3 minutes. To prevent the bleeding. After that, I'm going to inspect the IV catheter. After I remove this, I'm going to place in the proper disposal. That I'm going to dispose the rubber sheet and also the linen. After I dispose the linen, next is I'm going to dispose the the gloves that I've been using during the procedure. And after that, I'm going to sanitize my hand. To prevent the spread of the microorganisms.